Hi everybody, Dr. Donna Perosa of the Thought Word Academy, but today coming to you just as a woman who is trying to get pregnant. So I wanted to share with everybody my 2-week wait in this, my 6th attempt, which so far has been the first positive one in a year. So after 5 losses, finally we have an HCG that came back at 147. 2 days later, it doubled, more than doubled at 372. And now I'm waiting to go for my first ultrasound and again another HCG test, and hopefully everything is progressing appropriately. But I did make a video previously where I had shown the line progression from the first response as well as the WANFO and the PregMate. But now I just wanted to talk a little bit only about symptoms. So I'm going to make a short video here just about symptoms. I have been using the Fertility Friend app, that may be something that others use. Trying to get the, much light. Oh my goodness. Okay, I'm not gonna be able to see it. Anyway, I use a Fertility Friend app, and with that I check my basal body temperature, which has gone up slightly, but has stayed up each day since what I think would be implantation. So let's go back to the chart and I can give you guys some information about that. Okay, so I had my my transfer on the 21st of March, and that day it was really hard to say what I was feeling from the medication. When you're in the world of IVF, you're already taking estrogen, you're taking progesterone, you already have so many things that's trying to make your body think it's pregnant anyway, that the question is, are the things that I'm feeling coming from the medication I'm taking, or is this from what's actually happening in my body? So that is a question. Anyway, so that day there was just a lot of sleepiness. I was very tired, but I had driven 3 hours to go there. Everything took 3 hours between the acupuncture and the transfer and then the second acupuncture. So, and then 3 hours driving back. So I was very exhausted. So I can't really say what that was for, related to. Okay, so then I was checking my basal body temperature and it was normal. Then the first day after the transfer, I had really poor sleep, and I was hungry. I was super hungry at night. So I was really almost like insomnia, like I could not sleep. I just, no matter what, I was laying there, I was tossing and turning. I wasn't being nervous. Like this round, I said, I'm going to be very happy. I'm very positive. I was just watching comedies, listening to good things, talking with friends, just, everything really positive. So it wasn't anything that was mental. I just couldn't sleep. So that was the first day after the transfer. Now I had a 3-day transfer. So that's technically then this first day of the transfer would be 4 days past ovulation. Okay. So, and then it's always so hard when people talk about the transfer, but they don't say if they had a 3 or a 5 or a 6-day transfer. So you need to know that, I think, in order to compare to what you're going through. So, okay, second day, I had the same thing, couldn't sleep, and my appetite was only late at night. Okay, during the day, I wasn't really terribly hungry, but then all of a sudden by like 11 o'clock, I was starving. 11 o'clock p.m. So, and then I had one other symptom on that day. Oh, and that's when the frequent urination started, and it has not stopped. But again, I'm looking it up and I'm seeing could be from all the hormones I'm taking. Okay, so then by day 3, past 3-day transfer, so that's 6 DPO, then I noticed my first pitch. It was very exciting. I remember when I was pregnant with my daughter, I remember feeling around the same time a pinch. So a very strong pinch that I felt on my right side after like 3 days after the transfer. I had a pinch. Let's see what else I had. Oh, constipation. That's fun. Poor sleep again. And fatigue. Yeah, I was just tired. Frequent urination. Increased appetite again, 11 o'clock at night. And for the first time, I actually started to feel a little nauseous, which is pretty early for feeling nauseous, I think. But I'm just telling you what I felt. Okay, so then day 4, past transfer, which is now 7 DPO, I had another pinch, definitely feeling the pinches. I started to get really fatigued, which again could be from hormones I was taking, am taking, constipation. I only had 2 days of that so that we don't have to go through that again. My last day of insomnia, frequent urination, which I'm just going to leave out because I have that every day. And then, let's see, what's this one? Oh, heartburn. Heartburn started, which I always have, and tender breasts. That started to really ramp up. That was day 4. Day 5, I had some cramping. I really felt like cramping. I had frequent urination, heartburn, and nausea. Again, I skipped a day of nausea. Tender breasts. So going on to day 6, the pinching stopped. No, sorry, pinching stopped on day 7. So I had like on and off pinching. So I really think the implanting happened around day 3, 4, and then it was just kind of like light pinching, cramping sort of feeling after that. So by day, let's see, the next day, let's see, day 7. Day 7, I woke up with nausea. So that would be 10 DPO. And I had a backache. Backache came, that was something new. Frequent urination continued, and then moved into, what is this? Tender breasts, right? So let's just say tender breasts and urination, frequent urination, still going. I don't have to repeat that every day for the entire 2-week wait. So then day 8, which is then 11 DPO, I woke up nauseous again. Now I don't eat breakfast. I do a intermittent fasting, but even if I wasn't doing that, I can't eat breakfast. It just makes me, I mean, I like breakfast food. I just don't like to eat early. So I don't eat until 1 o'clock. But I was finding that if I didn't put something in my belly, I was not feeling well. So, and that's continued on for right now. I'm not like super nauseous. I remember when I was pregnant with my daughter, by week 8 is when it really got bad. I was very nauseous. So, I'm only in week 4 now. So to feel anything like that is a little early, I think, for me. Anyway, so like I said, there's 2 I don't need to continue on. My sleep improved, but now I'm getting up to urinate all night long. So even though I'm not insomniatic anymore, I'm sleeping, but I'm getting up every hour to pee, every hour to pee. Then I had day 9, I had like it wasn't like when I was pregnant with my daughter. I remember it was like the 11th week, my super smell kicked in, and it was like insane. I could smell coffee through a tin can. I swear I could smell everybody's cologne in the supermarket. Everything was making me sick. So it hasn't been like that. But day 9, it got really strong. I noticed that as a difference. Day 10, which was 13 days past ovulation, fatigue, tender breasts, frequent urination. There was the increased appetite went away, backache went away, but then started to feel very, very tired. Okay, my daughter woke up. So, anyway, getting very tired. Heartburn had subsided. And then lastly, which was day 11, which was 14 days past ovulation, which was when I went for my HCG, I noticed that I just have this sort of every morning, just a light feeling of nausea. My sense of smell has increased, not to the point that it's like the super smell, but definitely I can smell things more strongly. And then the what was constipation before has now become the every morning loose bowels. I remember that now. I forgot. I remember when I got pregnant that I had that, and that really started and has continued. So that was the day of the first HCG. So frequent urination, very tender breaths, fatigue. Oh, yes, the loose stool, and you can probably still hear it, the labored breathing. So I do have, which a lot of us get in the beginning, this feeling like it's hard to breathe. So that was, anyway, that was the test. That was when the HCG came back 147. And then after that, still the same. The next day, the same sort of symptoms, the labored breathing, the frequent urination, tender breaths, a little bit of morning nausea, fatigue. I find by like 3 o'clock, I just want to go to sleep. And on and off, a little bit of cramping. And then the last one, which was when I went for my second HCG, which came back at 372. That day was just more of the same. The loose stool in the morning, frequent urination, tender breaths, fatigue, and there was actually started me on the path of losing my appetite. So it's not gone, but it's definitely not like it was in the beginning where I felt very, very hungry. That's done. I just eat right now because I need to. I don't have a huge amount of appetite, but obviously going to continue on. So those were my symptoms, and hopefully that has been helpful. I'm actually going to add here, if I can, I'll try and upload the video of the line progression so you can see that as well. And hopefully some of this will be helpful to you guys. I know I watch these videos religiously of everybody who talked about their symptoms and what they're feeling, and every pregnancy is different. I mean, I don't think I had as many of these symptoms when I was pregnant with my daughter, and I was symptom spotting, believe me, but I didn't feel as much as early. I also didn't have as high of an HCG count as early either. And when I was pregnant with my daughter, her HCG, the first beta was 81, and the second one was 199. So starting off at 147, already being at 372, I think this baby is an overachiever. So that's where it's at, and I will be uploading follow-up, from the first ultrasound as well. And again, I am a PhD doctor in metaphysical counseling. I specialize in helping women with all sorts of challenges, men and women, but also I have a large following of women who I help with IVF because obviously I've been through it for years. I know what it's like. And sometimes you need a little bit of support, and I'm here to help you do that. So if there's any way I can help, please feel free to contact me here. And I hope everybody will have wonderful, amazing results. And I'm sending you all sticky baby dust. Take care, be well. Namaste.